What is up, everybody? It's Dr. Vibe here, host and producer of the award-winning Dr. Vibe show, the home of Epic Conversations. And I'm the host of Epic Conversations, 2020 Best Podcast News Award winner, 2018 Innovation Award winner given out by the Canadian Ethnic Media Association. Also, I host the only online show in the world for dads and fathers that is sponsored by Dove Men Care. It's also co-sponsored by Dad Central, Canada's national fatherhood organization. And I'm the board chair of the Global Food and Drink Initiative, which is a nonprofit based in Oakland, California, that amplifies Blacks in the diaspora that are doing their thing in food, drink, and travel. And I'm wonderfully joined tonight by Mr. Paul Osborne. Mr. Osborne.
Hello. Good evening, everybody. Great to see family here. We're going to have a beautiful conversation. As for myself, I am Paul Osborne, better known as the ENSA Community Cultivator. So I bring communities together, in particular those of the African descent, and make sure that we have these healthy conversations. That being said, tonight we are, ready and open to create this situation. My background is that I am a father of four, a husband, and a dedicated community worker. I am also a practitioner in the rites of passage, a fatherhood advocate, and more importantly, a Black community advocate. So, yes, we're going to start and make sure that tonight we have a beautiful conversation. All right. Thank you.
Absolutely. So before we really get down to some fun here tonight, just some rules of engagement for tonight's conversation. First things first, this is a safe and brave space, most importantly. And we want to make sure not only with this conversation, but the more that are coming, we have a safe and brave space. If you have comments, if you're watching live, whatever platform you're watching this conversation from, please type your comments into the comment section. We will look at them here as long as they're respectful. We will do our best to share the commentary with everyone here on the panel tonight. Not going to guarantee we're going to get everything in because there's a lot to share. And we have panelists and experts here that we want to make sure you hear from them. We also want to make sure they get a chance to hear from you. What we're going to be doing tonight, next up, this is the order of engagement tonight. We're going to be introducing each one of our panelists. And as they we'll introduce them, they'll say a little bit about themselves. And as they say a little bit about themselves, and we'll start getting into some questions with tonight's conversation. And also we have another gentleman joining us who is going to give a translation en français, if necessary. So we're going to bring Abdul to the stage. Abdul, how are you, sir?
Bonjour, monsieur.
Bonsoir.
You're on mute. How you doing?
Can you hear me?
We can hear you. Go ahead, Abdul.
Yeah, okay, I'm here. Je serai là pour faire les transactions, translate. So I'm here to translate from English to French. So if you have any question in French, don't hesitate to express yourself.
For sure. And for those who are in the Francophone community, we are encouraging you to please put your questions out there today. Please participate. And if there's any issues that are particular to the Francophone community that's impacted by the COVID-19 or just general conversations, Abdul is here to give translation, but also to share some of those concerns, issues, questions, or anything good. Okay. Dr. Vibe, I'm not hearing your audio.
You're not hearing me?
Oh, no, that's better. Go ahead.
Okay, no problem. No, just saying, next up, we're going to do a short introduction to each one of our panelists. So, yeah. Paul, you have two, and I've got three. So you got the easy job.
Well, there you go. All right, again, welcome. We have such a great variety and diverse amount of panelists today. I would like to start with Dr. Akwatu Kenti, who definitely is been doing work in the community for over 20 years. I'm going to speak that off the top. Anything to do with Afrocentric, to do lectures, to advocating for Black families and families as a whole. Dr. Akwatu has been doing so much great work. Currently, he's a special advisor on the City of Toronto's COVID Equity Action Plan and chair of the Black Scientist Task Force on vaccine equity. I would go on about his thesis, but we'll ask some of that later. But definitely, we want to welcome you, Dr. Akwatu Kenti.
Pleased to be here.
Here you go. We also have Dr. Candace Todd, and whom is a doctor of naturopathic medicine and health educator with expertise in health promotion and disease prevention. Nice to meet you, Candace. There you go.
Hi, everyone. Thanks for having me.
There you go. Great to see you.
All right. Now I've got the fun job because I got to produce and introduce all at the same time. So let me see if I can handle this well. So first, I'm going to put up Dr. David Burt, who's up next, and a little bit of Dr. Burt's background. He is an immunologist with more than 30 years experience in the research and development of vaccines against infectious diseases. So Dr. Burt, I want to say thank you so much for taking time out of your positive, productive schedule to share with us this evening.
I'm glad and pleased to be here with you.
Excellent. Next up, we have, I have Nia Singh. We're still waiting for one other person, but we have Nia Singh. I'm going to bring Nia up. Hey, Nia, how you doing?
What's up, brother? How are you?
Outstanding and blessed. People, Nia is part of the PACER 2.0 and co-chair of the Know Your Rights Committee. And he is also the principal lawyer at the MAT Legal, which provides placements for the Ryerson LLP program, paralegal, and co-op placements. So thank you for taking time out of your positive, productive schedule to be with us this evening.
My pleasure. Thank you.
Excellent. So what we're going to do is, before we get really down into the conversation piece, we'd like each one of you, in the order that you were introduced, to just share a few opening comments. So we'll start off first with Akwatu. Go ahead, please.
Yes, so a pleasant good evening to everyone, my fellow panelists, community at large, all of those of you who have questions. And, I want to start by first of all acknowledging that enslaved African Onesimus, who 300 years ago introduced vaccination science to North America by demonstrating to the people of Boston through the advice he gave to Cotton Mather, the slave master who owned him, probably from West Africa, Akan speaker. He told Cotton Mather that he wasn't worried about smallpox. There was a smallpox infection hitting Boston. He said, I'm not worried. Cotton said, why? He said, because in Africa, we know how to deal with diseases of the wind. That's what they're called, diseases of the wind. He said, the healer, takes someone who's mature, smallpox, scratches them and walks around the village, sticking everybody. And when they do that, you're good to go. And Cotton Mather didn't believe him. He went and interviewed other enslaved Africans and found out that the practice was widespread in West Africa. And so he decided to have an experiment, which led to what was called variolation, of the beginnings of vaccine science. So, I raise his name to, you might want to keep us company here tonight. COVID has hit people of African descent very hard. It has hit us hard in the pocketbook, but it has hit us hard in health and lives. We have borne a disproportionate burden of death from COVID. And there's no threat in the vaccine that matches the actual mortality threat from COVID. Right across the Western Hemisphere, from Brazil right up to Canada, we have died at minimally twice the rate of non-Blacks in the countries that we reside in. Brazil, Colombia, Venezuela, Trinidad and Tobago, Jamaica, you name it, right up to the United States and Canada. And the mental health impact has been huge because we have had incredible losses, but we have not been able to grieve those losses in the way that we normally do. In Trinidad, Haiti, Jamaica, Guyana, Barbados, we have 9 nights. And those 9 nights really allow people to process their grief in a way that's deeply grounded in African cultural tradition. Hey, 2 years, no 9 nights. You can't do it. You can't grieve properly. You see, you have the funeral on Zoom. That is not compatible with African tradition, where people are communal, they share their joy, they share their grief. That's how it is. And so we've borne a huge mental health burden because of COVID required public health restrictions for our own safety. But here we are, faced with our vulnerabilities, seen as never before. Everybody's seeing it. It's more than seeing one person murdered, as we saw George Floyd. We're seeing thousands of people die. And we want to make sure coming out of COVID that we prepare ourselves so that we never have another COVID mortality inequity like we did with this one. That's my main concern. As we come out of COVID, create foundations for communities right across the world so that we can prevent future pandemic effects like the one we've had.
Thank you very much. Dr. Todd?
Hi, everyone. So thank you for having me. And I completely agree with the sentiments of Dr. Kente. I'm here to really bring a holistic perspective to this conversation, which I think is appreciated in the Afro-Caribbean community. So that's it.
Okay, no problem.
As long as Dr. Kente.
You're making me feel bad, man. I should have wrap up in 1 minute. What kind of thing is that?
Listen. She's saving it all for later. She's saving it
Short and
all.
sweet.
That was short, Akwatu. That was short.
Okay, short and sweet. Dr. Bird, your turn.
Hello, it's really good to be with you this evening. As mentioned, I've actually worked in the vaccine industry in research and development, clinical trials for over 30 years. So I have a bit of an inside view of vaccines, and I'm particularly interested in and probably concerned about the conspiracies that surround the whole issue of COVID and COVID vaccines. And as a scientist, I like to investigate these conspiracy theories and debunk them if they're not accurate. So I'm sure we'll be talking about some of the things that people have been hearing on social media tonight, and I'm interested in discussing some of these issues and really engaging with the community around some of these issues.
Okay. Much thanks. And
right.
Ashay.
So next we have our brother Nia Singh, looking sharp, looking good, looking serious. Go ahead, brother.
Serious topic. Thank you, Mr. Beck, for inviting me and having me here today. My perspective on COVID is similar, but it's going to be drastically different from a lot of people on this panel. I'm very concerned about human life. I always have been. I'm a human rights lawyer, I'm a criminal defense lawyer, and a social advocate. So quality of life means everything to me. What I see with COVID-19, unfortunately, is that the way that it's been presented to the public has created such a hysteria that I feel that the information presented is causing as much or more damage than the actual virus itself. So I too am really interested in speaking on these theories, discussing what are so-called conspiracy theories, because when you have evidence for things, I don't think it's a conspiracy anymore. And I think we have to really tackle the fact that people's voices are being silenced, medical information is being silenced, and a lot of conjecture and speculation has kind of ruled what we do here. So through this conversation with my brothers and sisters, I hope we can come to some understanding as what is accurate, what is inaccurate, and make sure everybody remains safe and healthy.
Okay. Thank you much. Thank you much for that. All right. So as Dr. Vibe and I are letting folks know, we have been polling some people in the community, and people have brought some questions to the forefront. So we will have a series of questions that people have shared in the community with us, whether it's concerns, issues, or whatever the case. And as we see appropriate, or you guys see appropriate, you can answer the questions. I will allow Dr. Vibe to start and to put a couple questions out there, and then we can go from there. Sorry, Dr. Vibe, again, the air.
Yeah, so these are in random order. So what I'm just going to, here's our first question. What is the argument to threaten people's livelihoods in workplaces that have proved working from home to be successful? So who would like to jump in on that first? And it's not specific just for one person to answer. This is a conversation. It's not just a one person thing. So who would like to approach that first?
Well, I could start a little bit. You know, the current situation where we have had, you know, shutdowns and work from home situations has worked for people who can work from home, who have that privilege of working from home. But we have a lot of people, especially our lowest income earners, who can't work from home and who face and have borne much of the risks from COVID. In any case, the situation is not one that can be repeated many times because it's sort of maxing out the city's resources right across the world, because we can't keep crisis spending, and cities everywhere are trying to figure out how to prevent future shutdowns to the maximum extent possible. You know, working from home has been a double-edged sword. It's been demonstrated technologically possible. So long we've had mothers who've wanted to work from home or have, you know, sort of innovative ways where they go into the office once or twice a week and work from home the other 3 times because they're caregivers. And people have said no. You know, companies have said no, businesses have said no, governments have said no. And now we see, oh my God, why were we saying no? Because so much can be accomplished, especially for people who need to work from home. However, working from home also has disadvantages for the up and coming who have less tangible relationship with peers. Remember, you know, color blindness and race neutrality works best when people don't see us and face us every single day in a workplace or in a space. And stigma is always easier to sustain and magnify when we are separated and we lead separated lives. So I know many people don't want to go back to the office because they don't want to deal with racial microaggressions. You know, that's from a survey in the States of IT workers. And I sympathize. I understand racial microaggressions because I've studied it deeply. The problem, however, not being in those spaces are as problematic as being in those spaces. And not being in those spaces, especially for our young up-and-coming professionals, is problematic. So I actually think it's a double-edged sword, but I would err on the side of not just returning to normal. We have to have a new normal. We have to create a new normal for people of African descent right across the world, which involves, you know, anti-racism and ensuring that anti-Black racism doesn't rear its ugly head the way it did in 2020 and 2021.
Okay. Anyone else want to join in on, add on to the commentary that was just provided?
I would definitely like to. Dr. Kente, I just don't think you answered the question. What's the argument to threaten people's livelihoods when people can work from home safely and successfully? And I yet haven't heard one. So I'm just going to say that right now, and anybody else who wants to jump in, please tell me, why is it justifiable for people to lose their jobs if they can work from home?
Interesting. Okay. We will.
I mean, I can let me just. I mean, I've spoken with a couple of individuals who work in the health service, and I think by October 22nd they were advised that you know, they would need to be vaccinated in order to maintain their jobs. And one of these individuals is in administration, and he's been working from home for most of the time that the pandemic's been on. And he asked the same question to me. Why I'm working from home? Why should I need to be vaccinated? And you know, that's I think that's a good question until the situation comes where he has to go back to work. And you know, I can understand in the health service where someone's working with interacting with individuals who are interacting with patients who might be vulnerable. I mean, I can understand why in that sort of industry, there's concern about, transmitting COVID to other people. I mean, my question to him was, are you going to be working from home permanently, or is it a temporary issue? I mean, if it's permanent, then I can understand. Maybe he doesn't need to be vaccinated because he can work from home. But I think a lot of the working from home individuals are working from home temporarily, and especially if you're working in the healthcare with frontline workers, I can understand why these mandates have been issued.
I still don't think the question's answered. Like, I still haven't heard a justification to fire somebody if they're working from home, if they're not vaccinated.
Okay.
Well, I don't know how much. No, I'm just saying, and from a medical perspective, I don't know how much more could be said. I don't know if anyone else from a medical perspective. I think maybe there's, and again, you have a background in law, so you probably have a little bit more, because I think this straddles, and correct me if I'm wrong, into a legal end also, not just a medical end.
Absolutely. Everything about COVID-19 straddles a legal end. And unfortunately, it seems like our legal system is not doing anything to protect us. And I can tell you this, from a medical perspective, I'm not a doctor, right? But I can read, and I can read studies. And I understand that whether you're vaccinated or not, you can still contract and spread COVID-19. So anybody in an office who's vaccinated, they have no advantage over an unvaccinated person. Who has the advantage are healthy people with strong immune systems, people who aren't stressed, people who are eating healthy, right? That's the issue. And I don't understand why any company is going to go along with firing employees because they've chosen to rely on their natural immunity. They've chosen to be who they are, when the same people who are vaccinated still pose a threat to others. It just doesn't make logical sense.
Maybe Candice should address the issue of natural, or not even natural, but healthy immunity, and whether that is something that protects us.
Yes,
So I do agree with you with respect to the mandates for people who are working from home to be vaccinated. It doesn't make sense. With respect to relying on your immune system to prevent you from getting COVID, or being protective against COVID, it's sort of a slippery slope. Like it doesn't, there's no evidence to say that you will be protected more than somebody else because you do this, that, and the other. So definitely there are measures that you can take to support your immune system, but it's not going to reliably protect you from getting COVID, or passing on COVID if you do get infected and you're not, you don't essentially it's not going to protect you from passing it on to others. Similarly to the vaccine, but with the vaccine, there is evidence to support transmission in terms of lowered levels of transmission. So to say that, absolutely your immune system is going to be protected if you eat healthy and you get quality sleep and you take these supplements, it's unpredictable.
So can I ask a question, Dr. Candice? Just on that place, you mentioned about some things that folks could do naturally, sleep, diet, whatnot. Are there any natural remedies or treatments that have shown to be effective against COVID, or any advice you would give to folks?
So yes, there have been natural remedies that are effective in treating COVID, but not preventing you from getting COVID and not preventing you from getting severe COVID or dying from COVID. So vitamin D is one of the big ones. It is really prevalent now because we're heading into the winter months where we're not getting as much sunlight. So, speak to your healthcare practitioners about testing for vitamin D potentially and supplementing with vitamin D. It's really important in mounting an immune response or mounting antibody responses when it comes to getting any sort of infection. The other things are things that you do. So to the point of like healthy living, it is important to get good quality sleep. Sleep is important in protecting your immune health. It's important to support your stress levels or manage them essentially. And that is something that the Black community has really been struggling with, at least for my practice anyway. It is something that, from a mental health perspective, we don't always prioritize, but really important to support, or really important in terms of protecting your immune health. And then the other sort of healthy living things. So eating nutrient-dense foods, yes, that's going to be important to support your immune health. Water, getting outside, exercise, all of those things are really important. Getting key nutrients, vitamin D is one that I mentioned, zinc, as well as vitamin C, also super important. But again, not going to protect you from getting COVID or having severe COVID or dying from COVID.
Okay, thank you for that.
Yeah.
I
If
do
I may,
ask
I
a
just want to
Go
just
ahead.
respond to the point that was raised earlier about this argument of why. No, I'm not privy to what, if any employer decisions. I haven't been in any boardrooms and sat through the meetings where people were deciding should they have a mandate or shouldn't they have a mandate. I've always argued from the very beginning that if a mandate ever happens, we have to be very sure that we have expended every effort to reach all corners of the society, all communities, marginalized and non-marginalized, and make sure that everybody has been provided with access to evidence so that they understand fully what are the choices they have in taking or not taking the vaccine. And we're not there yet. Last year, we had 77% of our population saying that they want to be vaccinated. We were the highest highest numbers in terms of people not wanting to be vaccinated last October. This past June, it was 56%. At the beginning of October, 36%, compared to 16% for white Ontarians. So we still have a huge disparity in terms of wanting to be vaccinated. And I don't even know the actual numbers for people who haven't been vaccinated versus who has been vaccinated. And I understand this point about vaccination may not prevent transmission, but we don't know if what the level of transmission is when you're vaccinated. We know you have a viral load, but we don't know how communicable you are to other people. We do know, however, if you're vaccinated, the chances of you having severe COVID are very unlikely. The chances of you dying from COVID are hugely unlikely. And really, if you want to protect your health system from collapsing, going back to normal where you're able to do surgeries for cancer, surgery for the challenges of everyday life without a pandemic, the only way to do that is to achieve some degree of herd immunity. And because of the Delta, herd immunity cannot now be reached without a minimum of 90% vaccination. So we're not there yet. Will we get there? I don't even know. Does the 90% even matter given the global inequity in vaccine equity? I don't even know. But just in terms of protecting our own hospital system, which has come close to collapse on a number of occasions because all our ICU beds were used up. From a health system perspective, I don't see much choice in the matter.
Sorry, Dr. Kente and Dr. Candace, are you aware that natural immunity protects better against the Delta variant than the vaccine? Are you aware of the Israeli study with 2.5 million people And are you aware of all the studies that show vaccine effectiveness wanes after 6 months, where natural immunity lasts years? Are you aware of those things?
So who wants to go first? Natural immunity. Okay, let me put it this way: your body system fights the disease anyway. So you need a strong strong immune system to defeat COVID. The vaccine doesn't fight the disease. The vaccine equips you with weapons so your troops, your cells, can fight the disease. So if you have a strong immune system, that increases your chances. That's why people in Israel, who you cited, they've had a lot of people who are vaccinated end up in the hospitals, but many of them, in fact, most of them have been illnesses 60s. So their age and their illnesses put them at risk that even the vaccines couldn't equip them to overcome. So, yeah.
I think the data does show. I mean, it's clear that if you're vaccinated, if you've had COVID, you're going to generate an immune response, and you're going to have antibodies and T cells that can protect you. So, but I mean, you have to weigh the risk of infection and the impact of being infected with a virus, which could be a severe infection that could cause you to go to hospital. I mean, the worst case scenario is death. But that exposure to the virus is almost like the first immunization. The results show that if you get at least one dose of vaccine after you've had an infection, you get an even stronger immune response, and against Delta too. So I would say, yes, people who have been infected will get a good immune response. It'll be better if they have a boost with the vaccine. But the risk, I mean, you have to decide, do you want to get your immunity by being infected with the possibility of getting a severe infection and the results of that? Or do you want your immunity to come from being vaccinated with a very safe vaccine, an effective vaccine? That's a choice you have to make.
And when you say natural immunity, what exactly are you talking about?
Talking about our body's natural responses to any type of infection. For example, we know that viruses, there's all types of viruses across the world. I'm going to use her as a
Nia, I just want to interrupt. You have yeah, it seems that your audio is not great. So I'm gonna ask you to log out and come back in, okay?
Yeah.
Thanks.
Okay. So in the meanwhile, I want to raise something because we are talking about natural immunity, and I know there are a lot of people who are vaccine hesitant in the community that do believe in natural immunity. And I think there was a question around that piece, and I mean, Nia can probably clarify, but from what I'm hearing from folks, I think they're talking about whatever they naturally have in their systems to fight disease or anything of that nature, that they're confident in relying on that natural immunity. So I think that's what I'm getting from community.
Yeah, and even from my own practice, sorry, I feel like I'm echoing too. Even from my own practice, I have had patients who are maybe misinformed about what your immune system does and what in terms of protection. So I've had a patient, for example, who has said to me, you know, if I take my vitamin C and my vitamin D, won't my antibodies be good enough to fight this infection? And the answer to that is that the natural immunity that you get is by having the infection. So you get natural immunity from having COVID. And the risks with COVID is that they're unpredictable. So, we've seen like really healthy people get really sick. And, there's a number of, people that we talk about in terms of, you have underlying health concern and things like that put you at more risk for getting more severe disease. That we advise, or that I personally advise, you may want to consider vaccination as part of your whole protective healthcare regime. So it's important to distinguish between the two. Supporting your immune system is one thing, and immunity to COVID is another thing. So I just want to make sure that the two things are not confused.
Okay.
Thank you for that.
Thanks for that. So what we're going to do, Nia is back. I know you probably wanted to add something. So we're speaking that your audio is better. So please join us back, Nia.
Yes, please let me know if it gets messed up again.
No, you're good right now.
I'm good now? Okay, thank you. So, Dr. Candice, natural immunity, what I'm talking about, is our natural immune response to infections. And for an example, I was going to say herpes is something that people get infected with. It lays dormant in their body. But then when their stress levels go up and their immune system goes down, the herpes rises and it shows itself until they get healthy again. COVID-19 is a coronavirus. And we know that coronaviruses are connected to the common cold. We also know that there is no cure for the common cold. So what we're talking about is people living healthy lives, eating healthy, etc. I know being healthy is not going to protect you from everything, but part of strengthening your immune system is by getting sick. That's why kids eat dirt. That's why people do certain things. This is not a situation, and what I'm really disturbed with is how the whole medical profession and the government has advised people that vaccines are the only way out of this, and that natural immunity is nothing. We as a human species have survived millions of years. We've gone through tremendous things. I will not agree that this coronavirus is going to wipe out the entire human population if everyone's not vaccinated. It's not logical. It's not factual. It's not based on science. And even Dr. Candice, when you said that there is, you said the risks are unpredictable. They're very predictable. We know the older you are, the more susceptible you are to this disease. We know the underlying comorbidities, the more susceptible you are to this disease. So getting a cold and getting better is not the end of the world. If you're 90, it definitely could be a serious problem. If you're 90 and you have asthma and bronchitis, it's definitely life-threatening for you, right? So there's people who've been vaccinated who have died. There's people who are unvaccinated who have died. There are so many variables, but the issue is, for me, what I'm very concerned about is our human rights, the legalities, the quality of life, and how we have a two-tier system now because of people who are vaccinated versus unvaccinated.
I think it's not correct to equate COVID with a common cold, because it's not a common cold. It's people who are infected with common cold rhinovirus. They can deal with that. It really doesn't matter how old or how young you are. You can deal with that. COVID is a different beast. One thing is that it's brand new. Most people haven't been exposed to it. It infects and causes severe disease like we haven't seen before. I mean, 700,000 people in the US don't die as a result of the common cold. So I think this is one of the misconceptions about COVID. It's not a common cold. It's not the flu. It's a different animal, and to basically to say that our natural immune system can deal with it is wrong, because that hasn't been the case. That hasn't been the case at all. That's why people have become very ill. That's why people have died. And I always like to, I mean, if our natural immune system is so powerful, then I would say, why when HIV came along, why was it so devastating? We need vaccines against certain infectious diseases, not all of them, because certain viruses and bacteria know how to bypass our immune system. HIV knows that if it infects our T cells, which are the T cells are the helper T cells, it's like the conductor of the immune orchestra, then the whole immune system will collapse. That's why we haven't got them yet. We need vaccines against HIV. Luckily we have treatments, and most of the vaccines are against pathogens that have a way of bypassing or turning off or inactivating our immune system. Otherwise, our immune systems can deal with a lot, and they do deal with a lot of infectious diseases. But coronavirus, COVID, is a different beast, and it's mutating. And younger people are being hospitalized because of the Delta variant, and who knows what's going to come in the future. It's not the flu, and it's not a common cold.
Sir, I never said it was the flu. I said coronaviruses cause the common cold. COVID-19 is COVID-19. It's a respiratory illness. The majority of these illnesses are mild. Do you know the death rate in Canada is 0.072% from COVID-19? Did you know that 85% of people who die from COVID-19 are over the age of 70 years old? Like, these are things that people aren't talking about. And I'm trying to understand why professionals, educated people like all of us here, doctors, why aren't they sending this information to the public? Why are we going down this path where there's only one route only, and ignoring the actual science and the actual facts?
What are the other routes? I don't know of any other routes at the moment. There might be treatments later on, but we're in a pandemic and we have vaccines that are effective. Are you suggesting that we should just leave the elderly to suffer the consequences and the immunosuppressed to suffer the consequences? I mean, I'm trying to understand what the issue is regarding the vaccines that we have that are very effective.
How are they effective?
Okay.
Sorry, Neil.
Okay, I'll stop.
Because we
Yeah.
want to have this
go ahead.
conversation.
Yeah.
And we have some people who have comments. So
Yeah.
Dr. Vibe is going to read some of the comments. We're here. We're having a good conversation. So we want to ensure that folks on the outside also are heard. And so let's get some comments before we get back to the questions.
Absolutely. So, yeah. So I'll just be reading comments right now. There are some questions from the audience. We will save those till later if we get time to include them. So some of the comments we have here, there are people who are facing termination because they won't vax, who have worked permanently from home since 2015. Another comment, workplaces firing people who don't actually come into the office or put other workers at risk. I think that makes people wonder if the vaccination is really about health. It confuses the issue. Another comment here, unvaccinated and vaccinated individuals have similar viral loads, according to the U.S. Center for Disease Control and Prevention, the FDA, and independent researchers. Another one here, unvaccinated and vaccinated people transmit the virus at similar rates. Let me just, a long one here. Everyone needs to be vaccinated for us to get back to close to normality. We all need herd immunity, and therefore people should stop thinking about themselves and think about the community they live in, I believe, live in. Even though they are working from home, they still need to go to grocery stores extra, and if they are not vaccinated, they are more prone to be carriers of COVID. I totally support the mandate of getting everyone vaccinated. Another one here, we could always invest more in the healthcare system. Thoughts on treatments? That's a question. Let me just do here. Vaccine manufacturers admit that the effectiveness of vaccines decrease over time. Manufacturers don't know how effective the vaccines are after being in one system for 6 months. Another comment here, vaccine effectiveness against asymptomatic infection wanes to 16% after 6 months, according to Israeli research. Another one here, vaccine versus natural immunity is a choice that people should be allowed to make. I could go on all night, so I'm just going to catch up there and leave it there. But we appreciate all the comments that are coming in, everybody, and we'll move on to our next conversation piece. If 90% of Toronto is vaccinated and it's reported that hospitalization is slowing down, yet children are not impacted by serious illness of death, why is there a push to vaccinate 5 to 11-year-olds?
I'm not going to say anything because I don't support that. So whoever supports that on the panel should speak up.
Okay, I'll start. I'll start off. It is true that in that age group, children in that age group will not typically have serious disease, serious illness, but it's also true that they still can carry the virus, they still can transmit the virus, and again, I sort of understand why there might be a desire to have children of that age who go into school, who interact with teachers and other kids, who go home and interact with maybe vulnerable grandparents. I can understand why, when you have an effective vaccine and it's been shown to be effective in that age group, why not use it? But I can also understand the whole issue of the global pandemic, and I think there still needs to be a discussion about prioritizing vaccination. Should we be vaccinating the least vulnerable in the West where we live, when only about 3% of people in low-income countries have had one dose of vaccine? I think that is a discussion that has to be made, and you know, I can see both sides, and this is an issue that I'm not sure which side I end up on, but I don't think this pandemic is going to disappear until the majority of the world have had a vaccine or been vaccinated.
Okay. Can I ask a question just to follow up with that, Doctor? So there's a number that says 90%. Is there a particular rationale around pushing 90%? Is that?
Yeah.
Go ahead.
The 19% is related to the infection rate and reproductive rate of COVID, the Delta variant. Right. That's why you've seen the percentages grow from 75% to 80% and now 90% because the Delta is so infectious. Number one, I don't think we'll be able to achieve 90% without children being vaccinated. But having said that, for me, it's a real ethical issue. I mean, you know, not a safety issue, but an ethical issue, because I believe that people should be vaccinated according to risk, and that people who are health professionals, who are elderly, who have chronic conditions in Africa or the Caribbean or South America or Brazil should get the vaccine before people who are at lower risk. And when you consider that there's only a few people who are manufacturing those vaccines now, there's about 100 and so vaccines coming up. But right now, the major bulk producers of vaccines are few and far between. We're acting selfishly, and we are putting hundreds of millions of people at risk, and especially people of African descent who have almost zero access to the vaccine. So ethically, I'm really confounded by the decision as to whether we should vaccinate children before we vaccinate high-risk adults. That's number one. But number two, in terms of the decision and the desire, I think it's about school disruptions. And school disruptions are causing a lot of mental health problems for children, but especially all children at all levels, income and education, families and all that stuff. But the children that are suffering the most or impacted the most by the disruptions are children who are poor, living in high density situations, who have fewer recreational amenities, fewer supports for online learning. And so, from that perspective, again, the fewer disruptions we have, the better it is for those children. So, should they be vaccinated? Should we? I'm not definitive on the issue myself, but I do know for me, it's an ethical issue less than a safety issue.
Right. Well, you mentioned the disruption. I find it interesting. I'm not going to add to this point too much, but I know there was a study recently from TDSB that said our children, meaning Black children, actually did better during online learning. And some of that could be what you talked about earlier, Dr. Kwatu, around, going into places and spaces that might be anti-Black, or certain, teachers or discrimination, stuff like that. That's interesting. But I want to get Dr. Caddis's point or view on this. What do you think? If you want to speak to that.
Yeah, sure. So I agree that it's more of an ethical issue. My personal view is, that we sort of try to get everyone else under control, and then make your decision around your children. I'm very sort of pro-choice in terms of vaccination overall, and again, I think that it's an ethical issue. So, it's hard because this is maybe the least problematic population in terms of, getting sick from the virus. But again, there is a public health issue where there's potential for transmission.
Okay, thank you for that.
All right. Okay.
And I'd like to address this question, and I'll be brief. Why is there a push to vaccine 5 to 11-year-olds? There's two reasons, in my opinion. One is that people are misinformed. They don't understand statistics, and they're living in fear. They've been so programmed by all the media reports of deaths, transmission, to the point where they are fearing for their loved ones, rightfully so, and they're trying to protect them. And I don't blame anybody who wants to protect their family. The problem is the people sending these messages are sending inaccurate messages to the public. They are not fully informing the public. Why is there a push to vaccinate those people? My guess is as good as yours. However, it has to do something with this, what I see as forming a two-tiered system. Why are people being excluded from everyday life? Why are people being fired from their jobs? Why can't people get an education if they're unvaccinated? To me, the writing's on the wall that they want these young people to be vaccinated because they want them to be part of that class, the vaccinated class, that has access to everything in society. And the unvaccinated class will not. And until that changes, until vaccinated people recognize that this is unfair, it is unethical, it is inhumane to force people to do something against their will, especially when it is not even a year old, this vaccine. There's over 15,000 adverse reactions in Canada from this vaccine. There are over 5,000 serious reactions from this vaccine in Canada. And there's over 195 people who have died after taking this vaccine. And this is not a conspiracy theory. You type VAERS Canada, and you can see all the statistics on the adverse effects of this vaccine. And it's mind-boggling when the death rate for people under 19 is 0.06% compared to everybody else. And that's only of confirmed cases. When you go to the entire population, it's negligible. children 12 and under. Even 30 and under, it's mostly negligible. So we really have to think as a community, and I respect Dr. Kente for thinking of our African brothers and sisters, but we really have to think, is this good for our community? Africa has the lowest rates of COVID in the world, right? If this virus was so deadly and it hit Africa and nobody's vaccinated and they're poor and they're malnourished and all these things that we're led to believe, why hasn't the half of the African population died? Africa has the least. Look at the statistics. This is very disturbing. And until our community comes together to really look at the facts, not conjecture, not what we hear, not repeating these catchphrases we hear repeated over and over from the media, we have to stop that. We have to be fully informed when we discuss these topics and address the issues head on. And it's very disturbing that our 5 to 11-year-olds are being put at risk right now. And let me remind everybody about that 17-year-old boy who wanted to play hockey so bad, and he got a vaccine, and within weeks he was dead. And that's just one story out of many.
Okay, so I'm going to kind of jump forward, if you don't mind, Ed. I see an interesting question in the comments, and I'm just going to read the question, if that's okay, and anyone can answer it. Someone is saying, Black people were hardest hit even when everybody was unvaccinated for a variety of reasons, including health, environment, access to good food, etc. Can we discuss improving those inequalities? And maybe, if folks want to talk about how do we improve those health disparities in our community that existed pre-COVID and obviously during COVID, and if we're not lucky after. But is anybody willing to answer that? Just wanted to put that as part of the comment.
Yeah, well, that's a huge topic, because it's the structural conditions within which we live, which devalue Black life, Black labor. Even if it's highly professional labor, you get less income for the same job. So the challenges are structural. But because of those structural conditions, or some even call it structural violence, we find ourselves having a huge level of chronic diseases that we shouldn't have, because we don't have it in Africa. The prevalence of diabetes, hypertension, high blood pressure, asthma, attributable really to the social determinants of health and the systemic racism that we experience through our daily lives. And it is those chronic conditions which actually make us so vulnerable to COVID. Not anything biological, but and just living in the West in these kind of conditions makes us more vulnerable to COVID than we would be in Africa. So you pointed out to Africa, where people have had a lower mortality rate, but that's actually changing already because of the Delta. And the people that are dying significantly now are the health professionals who are unvaccinated, who have to provide care to people who have COVID. Uganda has been losing doctors and nurses by the day, my friend. And so for me, it's an immediate situation, because I have in-laws over there who are health professionals who are at risk. So I'm not talking about academic risk. I'm talking about real risk that I'm hearing about all the time. So for me, the question about vaccination is not just a question on theory of writing a chapter, should I vaccinate my children ethically, is it right? I got people who are overexposed and undersupported, and that's something to consider. But the structural changes require different types of strategies. And one of the strategies is what we do to alter the situation ourselves. So COVID could have been a huge bonus were we prepared to educate our children with our Afrocentric orientation, so that all the undermining that they get through the traditional schooling would be they wouldn't have that time go through the system. But we don't have the capacity, and we don't have the political will, and we didn't do it, and we're in COVID. But we need to be able to do that in order to sort of reduce the structural impact on us. So that's important because of the mental health effects, not the traditional mental health effects like anxiety and depression, but the anti-self disorder that comes out of someone coming through the system where they actually learn to be anti-African in their orientation to life. They come out not liking their own self, not liking their own features, not liking their own people because of the miseducation taking place. We need to be able to create institutions to address that long term if we hope to sort of mitigate the risk of living in a racist society. I'm not seeing that happening right in the short term. So we need to be practical and realistic about what we do when we can't change structural conditions that put us at risk. What else? What other choices do we have to prevent that? And I will not allow the seniors in my family and in my community to be at risk. I have a lot. We never had so many older people, by the way. Usually, up until the 1960s, our age balance was much more younger because the health system never supported us. So people died younger, and it's only a few who were genetically blessed would live to be elderly. And so suddenly, because of the changes, decolonization, the changes, the human rights advances in the 60s and the 70s and 80s, we have a demographic transition in a way we almost never had in the diaspora. Brazil had a lot of elderly people. Honduras have a lot of elderly people. Colombia, a lot of elderly people. And all of a sudden, the people who created samba, who created different types of dances, who created different kinds of music, believe you me, died in 2020. And I don't have the list. I can't pronounce most of the names, but COVID has really wreaked havoc on our senior population. And it's not something to be left to chance. Anything that we can do to prevent mortality risks for our most vulnerable, as far as I'm concerned, has to be done. It's an imperative. It's not a choice. It's an imperative.
Thank you for that, Dr. Kwati.
Dr. Kente, why haven't we put
Nia, I think, Nia, you're having that audio challenge again.
Okay, I'll be back.
So you may have to log out and come back in.
All right.
I'll be mute.
I just wanted to add to that it is imperative. We are this pandemic and the impacts on Black people, people of color, marginalized communities. It is rooted in racism, and it's this pandemic has really brought that to light, and it's important that we really sort of take hold of that and start to figure out the things that we can do to protect our health. I'm a naturopathic doctor. There was a comment in one of the comments said, how does a naturopathic doctor differ from a medical doctor? And we're really grounded in natural medicine and sort of the things that we can do with vitamins, minerals, with holistic practices to support our health. So I work at a very grassroots level, and it's not enough to impact everybody, but I personally am really happy to see that people are starting to recognize that we are at a disadvantage with respect to health outcomes, and that it's rooted in racism, and that there is a lot that we can do to protect our health.
Okay. Thanks. Nia, let's try you back.
I don't know. I don't see Nia here.
Oh, let me get him back. There we go.
Thank you. I was just going to make the point to Dr. Kente about if 85% of our people dying are over 70, why haven't we put 85% of our resources into those people? And my stance of saying that first and primary, we should rely on our natural immunity is not saying people should not get vaccines, and it's not saying we shouldn't pay attention. What I'm saying is the people who are most vulnerable are those elderly people and those people who have immunocompromised issues. But from the very beginning, this has been a blanket approach amongst everybody, whether you're healthy or not, to get vaccinated. And to me, that's where the problem is. If we had focused on elderly people from the very get-go, we wouldn't have had all those seniors' homes with massive deaths. And another thing that we're starting to forget is that we are humans. We are mortal. We are not immortal. And when people die over the age of 75 and 80, that's the natural course of life. And we're acting like this COVID-19 is taking people indiscriminately. It's unfortunately, it's killing people who are elderly and people who are sick. And if anyone is to analyze the flu death patterns over the previous 10 and 20 years, hundreds of thousands of people will die from the flu every year, right? That is a fact. These aren't, the way we're approaching this is just not helpful to us. And when I analyze this, and I have a big issue with the government and the health profession, because the only message has been wash your hands, stay at home, take the vaccine. Has anybody heard a concerted effort from any politician or medical professional to say, make sure you quit smoking, you quit drinking, you eat healthy, you cook your food at home, reduce sodium, reduce fast food? You have not heard that once, because I've been listening to the news just like you. Nobody's getting that message. And that is what I'm glad this conversation is happening, because voices like mine have been silenced. Anybody presenting a balanced narrative on this issue with facts, with science, has been shut down. And that's a huge problem.
Nia, can I just, I think every physician would wish that someone coming into his office with diabetes would change their dietary habits. But they know that most people haven't got that willpower, haven't got that ability to do that. They won't do it. And that's why they give them medication and hopefully medication and education about diet. But when you're in a situation like a pandemic, you're not going to change people's habits, health habits immediately. You've got to do something to really deal with the pandemic. And the other thing I would say is that the elderly were the first to be vaccinated. It was recognized that they were the most vulnerable. And after the first course of vaccinations, 90% of the illnesses and deaths that were taking place in the nursing homes didn't happen. They reduced that by 90%. So that was the population that was dealt with first. But like any virus that mutates, and these RNA viruses mutate like crazy, you don't know if there's going to be a mutation that's going to start impacting individuals who are younger. That's what we're seeing already with the Delta. So I think the obvious thing to do is to try and protect as many in the population as you can, as fast as possible, to prevent the virus from mutating beyond Delta into something that could be more dangerous. And that's how public health works generally. We're dealing with the unknown, but if you know you've got an effective vaccine and you know you're dealing with a virus that can mutate and can multiply, you can get 1,000-fold higher virus load in your lungs because of this variant, and it could be worse. Vaccinate. It's a public health issue. You can't say, oh, take vitamins, do this, because it's an urgent situation. I sort of disagree with the way that you're evaluating this.
Mr. Burt, what's the immediate situation? Where are people dropping dead to the point where we can't figure anything out? Did you know that most of the deaths that were counted were COVID-related deaths and not actually from COVID? Like, what I hear from you, Mr. Burt, is repeating what we've been fed to by the media, as opposed to really analyzing what's happening. They did not protect those old folks' homes in the very beginning. The vaccine didn't come out till December. COVID broke out in March. They had people going in and out of those old folks' homes like nothing. Those doors should have been closed. Yes, those doors should have been closed, and they should have had hazmat suits on and protected those people.
It's true. I agree. But I'm just saying that the vaccine worked effectively in that age group, and that is the best preventative measure that we have at this time. So
that's incorrect, Mr. Bird. It's not the best. It's one of many. And that's the problem again. Why do we keep saying vaccines are the best when vaccines actually increase your risk of damage? You have a young person who takes the vaccine and gets myocarditis and has a heart swelling when they could have just lived their life the best they can. And then if they get infected, their natural immunity will help them. There's no side effects from natural immunity.
Yeah. So,
Okay.
So it's very hard to have a sort of a debate where we have to sort of weigh risk of myocarditis, especially in people under 40, versus the risk. And by the way, you could get it from the vaccine and from COVID. You could get blood clots from the vaccine from COVID. So those things have to be taken into account. The problem is this: we're in the storm. People are floundering in the water. It's the last time, the last place you can learn to swim. You know, if you tell people to learn to swim, you have that natural swimming quality built into you. There'll actually be people who learn to swim. I remember when my dad threw me in the sea to learn to swim. I walked back to shore with my breath. But I had cousins who learned to swim. You know, they take them, they throw them in the deep. They learned to swim. Me, I didn't learn to swim. So I have in the storm, in the face of the storm, a COVID vaccine is a life jacket. It doesn't mean you'll survive, but it means you have a better chance of survive. The problem for us is that we want to give everybody in Canada 2 life jackets and deprive other people of life jackets when they're in the storm. And that's a real problem. And that, that's the only metaphor I could think to address this issue of how do we weigh structural conditions versus COVID risk, immediate COVID risk versus structural socioeconomic conditions that take longer to change it, even if you have the political will to change it, which we don't have.
All right. We're going to move on to our next conversation piece. So here's a question. I think it may have been already touched in some of the previous conversation pieces, but is there anything about any of the vaccines and its impacts that has made you feel there was a cause for concern?
Absolutely, but I feel like I'm taking up this conversation, and I don't want to do that. So I'm going to refrain, and I'll chime in. But I definitely have a comment on.
Okay. Any of the panelists, is there anything about any of the vaccines and its impacts that has made you feel there's a cause for concern? Okay.
So, sorry.
No, go ahead.
Me, I've seen just in practice a lot of women, and sorry, I thought this would be a Black dads sort of group, but I do see a lot of women in the conversation here. A lot of women who have had concerns about menstrual impacts and fertility impacts. And there has been research done regarding fertility, but there is still sort of data to be researched regarding menstrual impacts. So I think a lot of the time people equate menstrual with fertility impacts, but what the data is saying is that fertility, with respect to fertility, no changes or no differences with respect to vaccinated or unvaccinated people in terms of in terms of egg quality, pregnancies, miscarriages, things like that. But there's still data that is to be received regarding menstruation and its impacts. So the data is being researched.
I think one of the things that is not recognized about the rollout of a new vaccine is that even when a vaccine has been put into clinical trials, has gone to the phase 3 trials, has been approved based on the fact that the benefits outweigh the risks, and we all know that nothing is 100% effective or 100% safe, but the benefits of this vaccine outweigh any risks associated with taking it. And I think what people forget is that even after a vaccine is authorized and approved, there is a phase 4 where the vaccines are still monitored in real life use after giving to millions and millions of individuals. And when there's a safety issue that comes up, it's flagged. And just as we saw with AstraZeneca, as we saw with the allergic responses with the mRNA vaccines, what we saw with myocarditis, these severe but rare events were monitored, and health authorities made decisions about giving the vaccine to certain age groups. For instance, myocarditis tends to happen in the young. So the mRNA vaccines were not recommended in some countries for individuals below a certain age. I think the system is working. That's how the system works. And, you know, things that you don't see when you test a vaccine in 30,000 people, you might see rare events when the vaccine is rolled out to millions and millions of individuals as they are now. And that's when the health authorities react and make decisions, make new recommendations. So no, I don't see anything that worries me about the vaccines. I think the system is working, and we've seen it has worked, and recommendations have changed based on these rare but serious events that have taken place with some vaccines.
Mr. Burt, I'm sorry. How can you say the benefits outweigh the risks? Again, I don't find any foundation in what you're saying. Tell me what the benefits are for me if I were to get vaccinated and how they outweigh the risks. Please explain to me.
Okay. Let me give you one example. The risk of a blood clot. We know that if you take AstraZeneca or Johnson & Johnson, there is a risk, and the risk is anywhere from 1 in a million to sometimes 1 in 250,000. It depends on who's doing the studies or where the work has been done. If you get an infection of COVID, that risk is not 1 in a million or 1 in 500,000, but it's 165,000 cases in a million. This is from a COVID infection. And it doesn't have to be an elderly person. It could be, you could see that in any age group. And that's just one example of where the risk, the benefits of taking a vaccine in terms of protecting you against COVID and protecting you against risk of blood clots after infection. And it's the same for myocarditis. The risks of getting myocarditis after getting COVID are much higher than the risks of getting myocarditis after getting the vaccine. So that's the sort of benefit I'm talking about. It's been shown, it's been demonstrated.
Okay,
that doesn't make any sense.
Sorry, Ian. Sorry, guys. So I know we circled back around this whole piece around weighing risks, and I think that definitely that's a conversation that depending on what side you're falling on, we could go on for a minute. So I don't know, Dr. Vibe, if you want to look at some of the comments. In the meanwhile, we can pull up just so people are still into it. We're reminding folks we're going till 9:30. So please put your comments in or your questions. We want to pull it from the audience. This is a conversation that can go on for a very long time.
Oh,
And
yes.
Again, just really, as Dr. Vibe is looking at the questions, I really want to thank our panelists today. It's not over, but Dr. Kwatu Kenti, Nia Singh, Dr. David Burt, Dr. Candace Todd. We do really respect the fact that you guys are here. We're having a healthy, safe conversation. We have people commenting from all over the place. We got people in the UK, throughout Canada, some in the States.
Yeah.
So this just means that this is a conversation that matters, and that whatever you guys are bringing to the table at this point is important for us to really get at. Right. So, Dr. Bob, I'm going to kick it back to you and maybe share some comments and maybe a question from the audience, and so we can get
Yeah. Well, give me the responsibility of pulling one question out of about 40 that are in the comments right now.
So put, you want.
Okay. But first of all, again, I want to thank all the panelists doing a great job. It's not easy, and you're being very respectful, and we appreciate that. And everyone who's coming in to watch, no one's leaving. So you must be doing a darn good job. So my kudos to you. Comments? I'll just throw out a few right here. Someone saying children in Sweden didn't have their school disrupted. They just kept going to school.
Before can I respond very quickly to that?
Yeah, absolutely.
Yeah, the Swedish model has been extolled in various quarters, but 12,000 deaths in Sweden alone versus 4,000 deaths in Denmark, Norway, and I forget the other Nordic country over the 1 year period speaks to the problems of that model, which is a kind of a mostly older people who died. So it's this question of letting older people face the risk, and is that's a Swedish decision. I leave that to them. But for me and for African people who value our elders aren't just there. They deserve the very best. They've lived lives that are ridiculously harsh, and so we have to do in our adult way, protect them to the maximum extent possible. We will not be allowing. If I had, hey, I'm just out there saying like I can't remember the name of that song where if I had all the money in the world, priority goes to protecting our elders everywhere.
Thank you.
Another comment here. Interestingly, one of the panelists said earlier, quote, "Death is the worst case scenario," unquote, but many argue that living without fair choice is worse. I have heard passionate arguments about our ancestors that chose death over slavery. Our people have very deep feelings around this issue, and they should be heard, not silenced or ridiculed. It's a good point there.
Agreed. 100% agreed. We don't need another level of stigma. We don't need vaccination stigma. We got racial stigma, HIV stigma, mental health stigma, all of which gender stigma, they intersect, and sometimes the harms are compounded. Black male psychosis. Please do not call the police. The risk of amplified as you added each level of stigma. Do we want to add another level of stigma for Black people to be dealing with? Unvaccinated stigma? Absolutely not.
Another comment here. Also, we need to think about life outside of COVID. We are not safer or healthier with fewer nurses, fewer teachers and daycare workers, fewer bus drivers, etc. Let me just there's so many. We're gonna have to have a part 2 of this, everyone. So get ready for the request after this is done.
Let me insert a little bit of legal issues to what Dr. Kente just mentioned about our Black people and stigmas. I'm in the middle of a jury trial right now with 3 Black accused, right? No unvaccinated jurors are allowed on the panel. We already know our community doesn't make jury duty as it is. I had to raise an issue that it was unconstitutional to exclude unvaccinated jurors because you now limit the jury pool. You exclude the amount of Blacks that can actually be there potentially. And then you limit the thinking of the jury to one type of thinking, which is law and order, structure, follow the rules. Thereby, when you have a police officer on the stand giving evidence, those jurors are going to most likely believe that police officer without issue. But if you had a fully capable jury with vaccinated and unvaccinated, then you're going to have all perspectives where some people will be critical of what that information is being put forth. So if you're not aware, Dr. Kente, and I know you are aware, our community is the most unlikely to get vaccinated. So what we need to be doing is fighting for choice, like everyone in the comments are saying, fair choice, informed choice. Because no matter how you cut it, our community is going to be on the losing end of this once again. Because we are wise to the past atrocities committed by these governments and systems that are focused on money and capital and control instead of happiness, life, and freedom. And our people are not going to fall for the same trick every single time. And that's why you see most of us not taking this vaccine. And we have traditional methods of healing. We have traditional foods. We have healthy foods, spicy foods. Why aren't we promoting that for our people? Why have we been divided as a people to even have this discussion and be on opposite sides of the table? Dr. Kente, I've been in the circles with you. I respect you highly, but we're disagreeing on this.
Okay.
And I hope we can come to a consensus, because the information that I'm hearing to me is not accurate, it's not full, it's slanted, it's one-sided, and it's not being truthful to our people.
Just 2 points in quick response to what you just said. Number one, I agree with you. A jury of your peers shouldn't be distinguished along lines of vaccinated versus unvaccinated, especially when you know that you need to have racialized peers in there to ensure that you are judged fairly. 100% agree with you on that one. I forgot how I was going to respond to the other points.
I said we've been in the same circles, and I respect
you. No problem. As a matter of fact, I have people close to me who are unvaccinated. October 28th, 2021. I'm not telling them get out of my life. I'm not repeating subject getting outside. I still love them. I loved them last week. I love them now. I have to love them next week. And I'm living with them. They're my family. So I'm practicing what I preach. You understand what I'm saying? And I'm asking others to do the same. No problem. As Martin Luther King said, disagree without being disagreeable. No problem.
Right, but the thing is, our lives are hanging on the line now, right?
But again, I disagree. Our lives are hanging in the line if we put ourselves at risk of COVID.
My two
It's
daughters.
an infectious disease. It's African tradition to fight infectious disease with variolation, sticking. I mean, they even have people, in Ethiopia, they have a practice where they wash the kids who have mature smallpox, and they have other kids drink the water. I mean, we're not going to do that. You understand? Drink the water with the smallpox. So vaccination, immunization is not something that is foreign to our healing culture. So don't say we have traditional medicine, we have traditional practice. We have variolation, which is a variation of vaccination. What's the problem? There is no problem.
My issue is this. Our conversations need to be focused on choice, and they need to be focused on eliminating these mandates, because someone's going to take Buckley's and someone is not. Someone's going to eat meat and someone is not. There should not be a mandatory vaccination. I have two daughters who have worked hard to get to themselves, graduate university, and get jobs. And now their jobs are being threatened because they're not vaccinated. And I am not going to allow them to get vaccinated, because I'm not going to say for a job and for money, you're going to put your life and health at risk indefinitely. And this is the situation we're all facing as a communities. We have people who have worked hard to buy homes and get into unions and work for the city and become police officers, you name it. And because of their creed and because of their belief system, they are now going to be on the outskirts, ostracized from society, unable to go to a restaurant, to a ball game, to a dance club, to have a job or get an education. That's the more serious threat than any COVID-19 that we're talking about right now. And we need all of us to be on the same page to protect all of us.
And I agree with you. Again, we haven't this is my last, I don't want to monopolize the response, but I agree with you that we do not want to have to deal with this stuff. This rich, all it does is provides another excuse to discriminate against us. You understand? And I agree with you. So how do we prevent that? I'm not sure. I have no idea. But I agree with you on that point, that many will use this vaccine argument and vaccine versus unvaccinated as a means to discriminate, and that's always how that's how it's been. The war on drugs became a war on blacks. This is how it is. This is how it could be, and we have to stop it. I agree.
Thank you very much for that, brothers. I think that's a beautiful place to be at right now, because again, as we mentioned, whether vaxxed, unvaxxed, it means too much for us in our community that we don't want to be disunited, right? There are many other things that people have put in place to kind of disrupt our unity. So I think it's important, again, coming back to why we need to be here in the same community, have these healthy conversations. We are getting to the point now where maybe we'll do one or two more questions, but we want to have a good wrap up. We want to say, we know there are a lot of folks who are in the chat who are coming to this conversation that maybe vaccine hesitant, right? So we want to definitely have a last word around where will we see this conversation going, or some good advice that we can give to folks on a nice way to wrap things up. But I want you guys to think about that for a minute. But I don't know, Dr. Vibe, if there's another question, a pre-question that we have from before that we want to ask. Your ears again. We're not hearing you. Your mic.
Hold on. Just okay. There's so many questions.
You want to take one of the pre-questions that we had before? The pre-questions.
Yeah, let me just pull one of them up because.
And thank you everybody who's out there who's been involved in this conversation. It's great to see so much, so much input. And I see Dr. Candace, agreeing. There's a lot of, involvement and communication here. And I think that's a beautiful thing.
Okay, so let me pull a question from the audience. I'm just going to pick one and throw it out there. Then we can probably go to final comments. So let's just do something real quick here. I want to try to avoid something that's already been. Okay, here's one here. Why aren't we pushing for more options to available before we push for mandates? Anyone want to address that?
So could I just say very, very, the Black Scientist Task Force is not pushing for mandates.
Okay.
That's not our position. What we're trying to do is reduce risk and make sure that Black people know what we're dealing with respect to COVID and with respect to the vaccines. The mandates, the vaccine passport, the mandates, we saw these things coming and we said, please be sure, if you're going to go the right route, to have race equity mitigation strategies in place. Because the situation is such, we have such a high level of vaccine resistance for historical reasons, which is justified. We were late out of the gate because people were late in bringing the vaccines to us anyway. So mitigations must be in place to address our issues and our concerns. And we've been saying that from day one, that vaccine equity requires action on the part of the government, on the part of the providers, to ensure that people who have deficits of trust for good reason, people who have transportation issues, people who have technology issues, people who can't get sick days because there's not enough sick days allowed, or they have 0 sick days between their 3 jobs. Strategies have to be put in place to address their issues and their needs before we can actually feel comfortable in saying, do this. That's been our position all along.
Okay. All right.
Okay, anyone want to add on that?
And the question was, can you just repeat the question again, please?
Yeah, Nia, your audio is really bad. So.
It's okay. Come in and come out. It's all right. Come in and come out. We're doing this all night. All right? Okay. Yeah, so, no problem. I'm going to just put this out to folks again. Where we have it, we have a lot of vaccine hesitant, resistant, or just not getting it. We're not going to get the vaccine, right? Some people are saying, I'm not getting it anyway, right? They're coming to you, Dr. David Burt. What would you say to someone who probably is not going to be convinced by the science and the numbers and that stuff, right? But what would you say to that person? You know, like what kind of advice would you give to them? What do you think is important to share with them and I say from an African or a humanistic perspective, because I think sometimes that's missing in the conversation. And also, you know, I'll say lay people like myself, I don't understand all the science talk. It's not my background or my expertise. But David, Dr. David, what would you say to somebody, you know, who you're going to have this conversation with?
It really depends on what the issue is that the person has and what their concern is, and I think that's how we've tried to address hesitancy and concerns that our community has around the vaccine. First, I'd have to know what the issue is, what the concern is, and hopefully, as a fellow Black person in the community, I can address their issue with in an empathetic way, knowing that I'm part of the community, but I might have some information around if it's a scientific issue. I might have some information that can help them there. But you know, it really depends on the person and the individual, and I think for me the bottom line is that COVID-19 is a serious issue. It's been I mean, I've had friends who have died. I've got friends in the UK who have died from COVID. I've had friends who are similar age to me who have been in intensive care for months and have survived. So for me, COVID is a real issue, and I guess I would just try and help the individual to understand that it's an issue that we have to take seriously. And again, depending on what their concern is, just try and help them to for me to understand what it is, and then try and help them to find a solution around that issue.
Thank you much for that. How about yourself, Dr. Candace? Same question. Someone who's vaccine hesitant, resistant, you know, you're going to have a conversation with them. What would you be saying to them?
So I've always approached this and town halls in general by sort of laying out the information and creating a situation where you know, you're giving information to have people make their own choice based on their own personal risks and benefits. So that's always been my approach within this task force. So you know, I'm a naturopath, obviously, and I very much so believe in my profession and the magic of natural medicine. But I do understand its limitations sometimes. So presenting sort of both sides of the coin is important for me. And having people be able to make decisions that are the best for them is really important for me. So, you know, that includes, you know, am I doing all of the sort of healthy things that I can do to support my immune health? But also, like, what is my risk? Am I like in front of people every day? Am I, you know, do I work for the TTC and I have to confront people on a daily basis? Am I living in a multi-generational household? So sort of taking all of those things into consideration when you're making your decision, I think is important. So
thank you. And the same, same for yourself, Dr. Akwatu. How would you answer? I mean, how would you speak to this person, right?
I have one of my dearest friends who actually had COVID and still hasn't been vaccinated. Mm-hmm. And so they said, again, let me tell you what I told them. I said, do you know what your loss will do to me and my family? you're like a fixture in his family. If something get broken, who do I call?
Yeah,
Who do I call? Usually person is call. What am I gonna do? What will we do without you if you get COVID? Do you know what your next COVID is gonna be like? I said, what's your family gonna do without you? You're the rock, man. You're the rock of your family. What will that? And the third thing I said, well, Hannah, when you're ready to get a vaccine, call me wherever I am. I'm gonna stop what I'm doing, take a day off, drive to Usherwood, pick you up, take you to clinic, get you vaccinated. Wherever I am, you don't have to go. That day we're having lunch, dinner, wherever it is. I'm stopping what I'm doing and I'm coming to take you. And that done. We ain't talking about vaccines again, unless you ask me a question about vaccines. But I make my point, I communicate my point, and I leave it at that, because obviously the person has to come to their own decision for themselves. I just keep asking, anything yet? Any changes?
Right.
Because I don't ask like a standard English ask. You understand?
Right. All right. So Nia, I'm going to kind of switch it up for you a little bit. Obviously, we're in the community. We hear the cries, and a lot of people are at risk, of losing their employment or access to the social places and spaces. What advice, what advice do you have for folks that may be facing this reality? Just in a nutshell, really quickly, what would you advise?
The best thing I can say to them is stand in their truth, right? Don't let anybody or anything force you to do something you don't want to do. Because the second you go that route, then you're just as good as gone, in my opinion. Because if you are forced to do something against your will, what else are you going to be forced to do against your will? It's sad because people have guns to their head. Literally, they have guns to their head. They are being forced to take this vaccination. And when people talk about, oh, the vaccine rate went up, oh, look how good we're doing, it went up to 90%. Like, no, you forced people to do that. You gave them no choice. You told them that they're going to have a passport to go anywhere, to get on a plane, to get on a train, to have a job, to get an education. I'm a little bit different. I know I'm a bit out there or extreme or whatever you want to say, but that's me, right? And I fight for people's rights no matter what the cost. I can't expect every person in the population to have the same approach. They may not be self-employed. They may rely on another job. So it's hard for me to say to them, do what's best for you. But at the end of the day, like I said to my daughters, is this job, is this money worth your life? To me, no, it's not. So my advice is find a way to live outside of this system that they're setting up to exclude you from, if that's going to be your choice. My first thing I say, be healthy, eat wise, don't put artificial flavors and colors into your food. Buy and cook as much as you can. Don't overdrink, don't over-smoke, reduce your stress. Like, these are all things that contribute to the susceptibility of any disease, of any virus, COVID-19 included. And if you can maintain your health and not have regrets, I think whatever happens after that is going to be better for you than you take this vaccine and then regret it. I know someone who took it, had a horrible experience, and didn't want to take any more, didn't want the second shot. And I questioned them. I'm like, you already went this far. You have a chance to be part of society. You might as well take it. Like, because you already went in, right? But for people who haven't gone in, I'm like, once you go in, you can't come back. Right? You just can't. We don't know what mRNA is doing, right? There's so many different theories. There's so many different scientific studies, etc. But at the end of the day, we don't know what it's going to do in 5 years, in 10 years. We don't know. But we do know there's adverse reactions. So all I can say is what is happening now is not, from my perspective, it's not about health. This whole vaccine mandate is not about keeping you healthy. It's about making you comply. And it's very disturbing that we have taken away free choice from human beings, where you can't choose your destiny. if people, and this has been coming up on the comments, and this is the most basic argument. If you have the vaccine, what are you worried about? If you have it, how are you going to be affected by anybody else? That should have been the truth and the reality of this all. But as time unfolds, we know, yeah, if you have the vaccine, you should be worried because the vaccine doesn't protect you.
Okay.
Right? It does not protect you.
All right. So I know some folks are shaking their head, and we're gonna in a healthy community, we open many opinions and we keep it balanced, right? So that being said, I'm gonna kick it to my man, Dr. Vibe, to give us a little wrap up because he always ties it up so nice like a present. I'll allow him to do that. And again, I'm gonna give my thanks to Dr. Akwatu, Dr. David Burt, Dr. Candice, Nia Singh.
I'm a Juris Doctor as well.
You're a doctor. You're a doctor.
Juris Doctor.
Listen, you're a doctor. JD. So definitely, I want to give it up to everybody because I think that we needed more of these courageous conversations, and I'm hoping that we provide more opportunities to have more of these conversations. I personally will be doing some work out there, weekly conversations similar to this. I'll maybe share my contact, my email if Dr. Vibe could do that. But I'll be doing conversations on Wednesday from 3:30 to 4:30. I will give folks the details. If you're interested, I don't know, Dr. Vibe, if there's a way that they could put their contact in the chat or whatever it is. But I will share my contact and folks can get back to me at that. That being said, Dr. Vibe, I'm gonna kick it over to you and thank and love everybody in the community right now who showed up. I think it was, a great conversation and looking forward to more.
Well, again, Paul, thank you as always. It's a pleasure working with you on great events like this that advance our community in a positive direction. We've got a lot of work to do, family, and sometimes it's going to be tough work. But the thing is, we want to make sure it's better for each one of us. So I like to say again, thank you to Akwatu, Candice, David, Nia, and there were people behind the scenes. Much thanks for a great conversation. What I will say is that there'll be more to come. And folks, I'd love to give all the comments. We'd be here for 5-6 hours. So what I'm going to say is continue the conversation on whatever platform that you're on. And also we're going to be taking and looking at the comments, myself and Paul. So we're speaking, they're going to have a part 2 so we can incorporate some of these comments and questions for the panel. Hopefully we'll have all these panelists back. If not, we'll have new panelists on and we can take some of the questions that didn't get approached to this time, next time. So as always, I think especially during this time, I will just say the most important thing for all of our people, no matter whether you're vaccinated or unvaccinated, 2 last things. Comment here, someone said here, whether we are vaccinated or unvaccinated, we are all going to feel the effects of these mandates collectively. So whatever side of the fence we're on, we're going to feel it. So the most important thing I want to say is give yourselves grace. Most importantly. So on that note, we're going to end the conversation. And please continue to converse on whatever platform you are watching this. We like to say, everyone, have a great night. And thanks for taking the time to share with us tonight. Be well and keep the faith, everybody.